So PRP treatment stands for platelet-rich plasma. It's also known as the vampire facial. It's been around for a long time, and it's used in clinics for skin rejuvenation, helping to soften fine lines and wrinkles, and create a lovely glowing looking skin. Kim Kardashian made the treatment popular some years ago, and yeah, it's known to be used as a celebrity treatment. So the procedure is that you come into the clinic and we take some blood out of a vein in your arm, just like a blood test at your doctor's surgery. And then we take that blood and we spin it in a centrifuge, and that splits out the platelet-rich plasma from the red blood cells. The red blood cells are discarded, and the platelet-rich plasma has all the good regenerative properties in it, and we inject that back into the skin wherever it's needed. So for cosmetic purposes, that's in the face, so for fine lines and wrinkles. Okay, so the plasma is the straw-coloured fluid that's used to be injected back into the skin. This treatment has been around for many years, and it's used in a lot of fields of medicine, for example, for things like burns and bed sores, for orthopedic uses, you know, to regenerate where you've got bone injuries and things. And within the platelet-rich plasma, those platelets will stimulate stem cells, and it's the stem cells that then make whatever tissue is needed. So again, for sort of purposes for the face and so on, that would normally be to produce new collagen, which obviously makes lines and wrinkles look better. So when you have a PRP treatment, you need to have drunk a couple of litres of water before your appointment, because that means that we can get the right ratio of your blood cells to give you the best results. After the blood's spun in the centrifuge, the straw-coloured fluid is taken off, and that's injected back into the skin. So it's a series of small injections, very tiny needles. There is a possibility of bruising. It's not particularly uncomfortable because we put some numbing cream on after we've cleaned your skin before the treatment, and the whole appointment takes about an hour. Once the plasma's been injected back into the skin, then over the following month to 6 weeks, that's when all the new skin cells have started to be produced, and that's when your skin will start to improve, regenerate, and look more glowy, and your wrinkles will look better, and your overall appearance would be improved. Usually we recommend 2 to 3 treatments for most people, usually about a month apart. We're performing a series of small injections, so there is a possibility of bruising, but usually it's minor if that occurs. You may get a little bit of swelling for a day or two. Again, that's usually minor, and all of that's kind of settled within a day or so anyway. Best results are after 2 to 3 treatments, around about a month after the second or third treatment. A lot of people like it because it's using your own blood. So, you know, you're not injecting anything that doesn't belong to you into the tissues. And people love it because it just makes the skin look amazing. And it helps with fine lines and wrinkles. So it's particularly good for things such as treating the eye area, where people get dark circles under the eyes and lines and wrinkles around the eyes, which sometimes can be difficult to treat with other methods. So it's an alternative to, say, for example, Botox or fillers and so on. They are medical treatments, and we've been doing them for years, and we've just upgraded our protocol, so we can now, we've got a very, very good quality centrifuge. There are some centrifuges around which are known to potentially damage the cells in the process. So our centrifuge is a particularly good one. So it spins that it's kind to the cells basically, which means that you're going to get a better treatment. As I say, they are medical procedures, so they should be done by somebody that's medically qualified, a nurse or a doctor. It's just about accountability, really. You can rely on nurses and doctors because they've got a professional registration to maintain. Plus, it's us being able to assess people adequately to make sure that it's the right treatment for you and you're going to get the best results out of it. Somebody without any kind of medical or nursing background wouldn't really be able to assess you properly and take account of your full history. It's best to book a consultation and come in for an assessment so that we can talk to you about the various different options of treatment. And usually that's myself or the other nurse that works here can carry out a consultation. That's usually an hour's appointment. With vampire facials, they can be a standalone treatment, and you can have those on their own, or you can have them in conjunction with other treatments, but we do just have to leave a gap between things like wrinkle relaxing injections and fillers and so on, and vampire facials. So people who we definitely wouldn't treat would somebody who's pregnant or breastfeeding, and certain medical conditions like autoimmune diseases might make it inadvisable for you to have treatment. Not necessarily because of, from the point of view of it being contraindicated, but probably more from the point of view, you know, if you're on a lot of medication and that kind of thing, that could interfere with the results that you might get. So you can expect to see results. You see it quite quickly after the treatment, usually within a week or so. Your skin will start to look a lot glowier. But then the regenerative properties of the plasma goes on for months on end afterwards. So you can expect even greater results after about a month, 6 weeks, and that process will continue in the following months as well. So you can book a consultation by calling the clinic directly, or you can book online. We've got if you go onto the website, indulgencebeauty.me.uk, and then there's a book now link, a book online link. You can click on that and then you can book in at a time that's convenient to yourself.